Medication Administration Module 3. Once you have signed them all and you have not received any alerts for any problems with your medications, you will be placed in the MAR. Your next step is to give your patient their medications. When you go to give your patient their medications, for example, let's say that they refuse their digoxin, what do you do because you already have it signed off on the MAR? You right-click where it says 0.125 and you unchart. In here, you will type in patient refused and then sign. What this does is it in-errors your documentation and it gives you back your task. This task can be rescheduled if necessary. To reschedule the task, you right-click, click on Reschedule this dose, put in the date and the time you would like to reschedule this task for and your reason. Click OK. Remember, this video is for functionality only. You must refer to your unit's policies on rescheduling medications before rescheduling any. Next thing I would like to talk about are med responses. You'll notice here we last gave this Tylenol at 11:03. We have a med response scheduled for 12:03, an hour later, because this is an oral medication. In that med response, you will document that this was given for a temperature and then do your vital signs. The Dilaudid, because it is an injection, an IV push, you can do your med response much sooner. To do this med response, we're going to double-click on med response. It will open up this power form. Again, we're doing this for pain, so we will choose either 0 to 10 pain scale, NIPS, or the FLAC, depending on your patient. For our patient, we're going to choose 0 to 10 pain scale, and we're going to document our pain. After administration of this dose of Dilaudid, our patient's pain is now at a 2. We're going to sign our form. You'll see here now on the MAR, you have documented that you've signed this and that your patient's pain is now a 2. The last thing I would like to talk about is the IV continuous infusions. You scroll back to where you have given your lactated ringers. Here is your begin bag. You can right-click here and modify. This will open up the charting elements for continuous infusions. Here you will see we began the bag in the left arm at a rate of 125. This medication was discontinued and another IV infusion hung directly after. So we would like to take credit from when we started this infusion until now. So this infusion was started today at 8 o'clock. I'm going to click into the infuse icon. It will pop up a warning saying this has been discontinued. We know because we have taken down this bag and added the bag of normal saline. We're going to say OK. They want to know between 8 o'clock and 11:23 how much has infused for this IV continuous infusion. I'm going to click in here and I'm going to calculate if this is going at 125 mLs per hour. And I'm going to round off here. Let's say 3 hours. I'm going to say 375 has gone in on the patient. So I will document 375 mLs. And I will apply that. And you'll notice here that 11:23, 375 mLs has gone in. Next, what we're going to do is we're going to sign by this green check and refresh. And you'll look down here and you'll see where it says begin bag. And you'll notice all the way over here where it says 375 mLs have gone in. Also like to tell you that in iView intake and output, you'll also notice under intake and output, 375 cc's is documented for you. This concludes Module 3.